Weight loss drugs like Ozempic and Wegovy are becoming more popular, with studies showing that they can work for some patients.
Our Taylor Brook explores the rise in popularity and weighs the risks and the benefits.
You've seen them in the news and in advertisements.
After kids, it's the medicine my body needed.
GLP-1 drugs like Wegovy and Zepbound have skyrocketed in popularity the past few years.
Girls that are wham in a circle.
Originally intended to treat people with type 2 diabetes, more and more people now use them for weight loss, even those you might not expect.
It's a miracle drug. I love it.
Joe Stanizek is the co-founder of Vio Med Spa and a consumer of Tirzepatide, a generic version of Zepbound. He started taking it September of last year.
I can't speak enough about it. I really do feel like a new person by being on it.
Sitting at 275 pounds at the time, he still appeared fit to the average eye. But his body mass index, or BMI, qualified him as obese.
I could see it in my face. My face was holding water. No matter if it's muscle or it's fat, it's stress on your heart.
A year later, he says he's lost 30 pounds and never felt better.
I feel like more energetic. I'm not tired throughout the day.
According to recent studies, prescriptions for GLP-1 medications have tripled since 2020, with hospital systems and even med spas prescribing the medication. Dr. Naseeb Shaheen with Ohio Health says the drugs have helped millions of people in different ways, from losing weight and managing diabetes to reducing sleep apnea and improving cardiovascular function. But still, he says not everyone's a candidate.
These medications are not just benign injections that you give yourself to lose weight. They are medications that treat metabolic disease and metabolic disorders that come from that. They aren't to be used simply for aesthetic purposes.
Dr. Sarah Aka with the OSU Wexner Medical Center says as pharmaceutical companies continue to introduce new GLP-1 drugs for weight loss, the fad is expected to continue growing. While she sees the benefits, she says there are still many unknowns.
The first drug that came out was in 2005. So we've only had this drug out for 20 years. We don't have long-term data of like 40 years of data like I have for metformin or some of these other medications of saying like, what is that going to do? And so that's been the ethical question about whether we put pediatric patients on this.
For Stanizek, it's worth the risk.
I'd probably send 2-3 people a week maybe to do it, to get it done. It's unbelievable.
But just like any prescription drug, Dr. Shaheen and Aka say there are risks, so consider carefully.
Just make sure you work with your doctor. Ask the questions, do your research.
Taylor is here with us now. Okay, so I think when you get on social media, you see a lot of people talking about the drug, taking the drug, saying that they plan on taking the drug in the future. So first I want to ask, how many people are actually taking this? And also, I want to talk about the accessibility of it because it's pretty expensive monthly, right?
Yes, it can be pretty expensive. Now, studies show about 12% of U.S. adults have taken GLP-1 medication, so that's about 40 million people. That's a quite big number, right? Data shows the usage is very similar among men and women, but varied by age group. So the most people using them are typically between the ages of 50 and 64. As for the cost, that does vary by drug. They're typically around $1,000 per month before insurance. But prices have been decreasing, guys, which is a reason why we're seeing more and more people go on these drugs. It still is a cost barrier for some, but they are decreasing in some cases.
Now, some may be saying that sounds too good to be true. Are there side effects? And if so, what are they?
Okay, so the side effects can be pretty intense. Some people have actually ended up in the hospital because of them. People have reported things like nausea, vomiting, constipation, diarrhea, not things you really want to have. Also some heartburn. The key is to check with your doctor before you use them. Experts say people with a history of pancreatitis, certain thyroid cancers, or even certain kidney diseases should not be using these drugs. So again, be sure to work with a qualified physician. You are not to use these drugs, just as an insert it and then continue on with the same lifestyle. It's meant to be used with better diet and exercise.
Gotta kind of pair it with a lifestyle change as well. All right, thank you very much.
Taylor Brook, thanks.
You bet.